So if you're only missing one tooth, why a dental implant over a traditional bridge?
Yeah, great question. The easiest way to probably is to ask another question back at you, which is, if you're only missing one tooth, why do you want to take that problem and make it a 3-tooth issue, which is what a bridge does.
Okay.
Patients need to understand a bridge is taking 2 good teeth, grinding them down to receive a crown, and a bridge is really just 3 crowns hooked together, bridging the 2 good teeth to replace 1 tooth that's missing in the gap. With a dental implant, you can address that 1-tooth space with a 1-tooth solution and not touch those 2 other teeth.
What about expense?
The expense actually is very comparable. And the expense over time with the dental implant, if done properly, should be less. A bridge, longevity-wise, is about 2/3 to half of what you're going to get out of a dental implant. And when that bridge fails, it's oftentimes not just going to be 1 missing tooth at that point, it's going to be 2 or 3 missing teeth. And now the solution to restore that space is going to become much more costly and expensive.
So if one of your family members of the age to get a dental implant is just missing 1 tooth, would you always go dental implant?
Every
Always?
time, every time.